Good
Hi.
evening, everyone. Welcome. I apologize for starting a few minutes
I'm
late,
about to
but
do a website with Washington Township. That's kind
we, we had a technical glitch that we had to get
okay,
corrected with
great.
our parents. And welcome to all of our panelists. Sorry about the technical glitch. To all of our parents, hopefully everyone is getting logged in and successfully joining our broadcast this evening, because we have an A-list panel tonight for our Washington Township parents. Before we get to our panel, however, I do want to give some updates and kind of set the scene for our conversation tonight. Washington Township Schools does plan to start the 2020-21 school year as originally scheduled on July 30th, unless directed otherwise by Governor Holcomb, Mayor Hogsett, or the Marion County Health Department. Specific details on reopening are under review and development. The Indiana Department of Education released guidance on June 5th, 2020, pertaining to the opening of schools. The nearly 40 pages of recommendations includes a wealth of information, operational details for our consideration, budget implications, and planning timelines to review. We have begun this extensive review and planning, but it will take time as the details within the guidance are vague and need Washington Township interpretation and decision making. I, along with the other district leadership, are attending numerous meetings with the Department of Education, Marion County Public Health Department, Marion County other school districts collaboration, even meeting with Mayor's Office representatives to continue this comprehensive planning. We have formed a Washington Township Reopening of Schools Task Force as well that will begin meeting and has representation from all levels and areas of our schools for planning purposes. Additionally, each school is forming a school-based reopening of schools task force to individualize the district plan to their specific school operations. The survey that all of our parents received is extremely important to our planning. We resent out the link to this survey today, so it should be fresh in your emails, and it is important that all parents complete that by the deadline on Saturday. For this reason, and as shared in the advertisements about this forum tonight, we will not have specific details regarding the plan for Washington Township Schools reopening, as that development is currently underway. Instead, we are thrilled to have a panel today with leadership and healthcare expertise. I'm appreciative to each of them for taking time out of their extremely busy schedules to be with us this evening. Due to the nature of this particular parent forum, having panelists and guests, we did ask for questions to be submitted from parents ahead of time to give our panelists an opportunity and time to prepare. So we won't be having an open Q&A as we have in our past forums, but we did get a wealth of questions submitted. Dr. Taylor, our Assistant Superintendent, is joining me this evening on the broadcast and will give an introduction to each of our panelists this evening. As he introduces you, if you could please wave so that our parents viewing the forum can identify you. And after introductions, I will begin the Q&A from questions submitted from our Washington Township parents. Dr. Taylor.
Yes, good evening. Thank you, Dr. Woodson, and welcome again to everyone in Washington Township, as well as our panelists. First, I'd like to introduce our Department of Education panelist, Dr. Jennifer McCormick, the State Superintendent of Instruction. Dr. McCormick is Indiana's 44th Superintendent of Public Instruction, a nationally recognized educator and innovator. Dr. McCormick has served at every level of the K-12 education system. As Indiana's education system leader, Dr. McCormick is an energetic and tireless advocate for children, dedicated to improving educational outcomes. She serves as a devoted ambassador for ensuring all stakeholders are working together for student success in Indiana. Dr. McCormick has served on a number of community boards and makes her home in Indianapolis with her husband, Trent, a public school administrator. They have one son, Cale, who attends West Point Military Academy. With Marion County Department of Public Health panelists, we have Dr. Kane, and we also have Ms. McMasters. Dr. Kane is a medical school graduate of SUNY, as well as the Infectious Disease Fellowship Program at University of Washington in Seattle. Dr. Kane serves as the director for Marion County Public Health Department here in Indianapolis. She demonstrates enthusiasm and energy for all clinical aspects of infectious diseases. Ms. McMasters currently works as the administrator of the Immunization, Infectious Disease, and Safe Syringe Program at the Marion County Public Health Department. She has worked for Marion County Public Health Department for over 20 years. Highlights of her career include overseeing the reporting and investigation of various infectious diseases and leading responses to large county outbreaks of diseases such as hepatitis A and influenza. She serves as one of the lead advisors on the health department's COVID-19 response team. Our very own Washington Township Health Service panelists are Mrs. Nicole Cooper, Supervisor of Health Services and Programs, and Ms. Stacia Davis, our Coordinator of Health Services. Mrs. Cooper earned a Bachelor of Science in Public Health and Education from Indiana University in December of 2008. As Supervisor of Health Services and Programs for Washington Township Schools and J. Everett Light Career Center, she supervises the Coordinator of Health Services to ensure state requirements are met for the nurses providing students with health services with a focus on management and logistics in our schools. Ms. Davis has a bachelor's degree in elementary education and a BSN in nursing from Marion University. She is currently working on her pediatric nurse practitioner master's in school nursing. She has been a nurse for 20 years, working in NICU, ICU, ER, and in the schools. She previously worked as coordinator of health services for Indianapolis Public Schools, emergency room at Eskenazi Hospital for 15 years, and has served on the infant mortality board for the state of Indiana and Marion County Health Department for 8 years. She's very involved in outreach programs and dedicated to contributing to the education and health of all of our community. And finally, our medical field panelist, Dr. Louis Profeta, St. Vincent ER doctor. Dr. Profeta is a nationally recognized award-winning writer and emergency physician at St. Vincent Hospital of Indianapolis, a level 1 trauma center. He has cared for more than 60,000 patients. He is the best-selling author, a dynamic and sought-after public speaker, and frequent guest appearances are on TV and radio. We are thrilled to have such an expert in the field on our panel and celebrate that he is a proud Washington Township resident, father of North Central graduates, and avid supporter of Washington Township schools. Welcome again, and thank you all to our panelists for being here this evening. And Dr. Woodson, I'm going to turn it back over to you to begin the Q&A session.
Outstanding. And for those parents joining us by the dozens every few seconds, we did have a glitch. We apologize about the link that was posted. We did send the correction back out. But for anyone who has struggled trying to get on or missed the introductions, this is being recorded, and we will send this information out to all parents so no one will miss any information due to technology issues. So we are going to dive right in with the questions. Again, parents submitted these questions ahead of time. The first question I'm going to ask of all panelists, but after that, just for sake of time, we will ask a question to a specific panelist. To begin today, I would like to ask, from your leadership perspective or your healthcare role, what would you like to share with Washington Township school parents about COVID-19 and the impact it has had during the last several months? We'll start with the Department of Education perspective. Dr. McCormick.
Well, first of all, Dr. Woodson, thank you for the invite. I appreciate this opportunity to address Washington Township families, and I know you are extremely busy and have done a wonderful job in that pre-prep time, so I appreciate the invite and look forward to hearing maybe from all of you and learning as well. So this has been a crazy couple of months for all of us, and what I have clearly learned is there are a lot of uncertainties, but people want certainties. So that becomes difficult to balance all of that. I've also, no surprise, the issue of leadership has really risen to the top. I mean, as far as the importance of great leadership and how that impacts an entire community. So that has been a big lesson. Also, the inequities across our state regarding funding, regarding resources, regarding capacity. And it's really been a lesson as far as the willingness as Indiana goes, as far as those who are accepting of a pandemic and those who are a little more reluctant. And so that has been a huge learning lesson just as far as tolerance of a community. So those are huge takeaways for me at this point.
Thank you. Let's go to the Marion County Health Department perspective. Dr. Kane or Ms. McMasters? Dr. Kane, if you could unmute.
Am I good? Can you
There
hear me
you go.
now?
Yes.
Okay. First of all, I'm honored to be part of this distinguished panel that you have, and delighted to have an opportunity to talk to parents in terms of probably the most deadly virus threat that we will see in this century that is so contagious and associated with significant illness that I have to compliment you, Dr. Woodson, Department of Education, for the wonderful job you've done through the state of Indiana, Dr. McCormick and Dr. Woodson for Washington Township. And it highlights the fact that expertise and knowledge is really important in preventing the transmission of this infection. And everybody has to be involved in terms of being educated to know what to do to protect your children, people in your household, while working hand in hand with the school system. And let me tell you, a month ago in Marion County, we were experiencing over 400 cases a day in Marion County. 2 weeks ago, that dropped significantly to averaging about 150 cases per day. About a week ago, it dropped significantly to less than 100 cases a day. And so I have to compliment the community, you parents who've been following these special guidelines of knowing what to do in your environment in terms of disinfecting frequently touch surfaces, teaching your kids how to wash their hands frequently. And the most important point is, if any of your children are sick, please make sure they're staying home. And the health department, along with the school system, can really readily help you get health care services if you don't have a primary care provider or you don't have the resources. That's why it's important for us to work hand in hand related to this. So I'm just excited about having an opportunity to answer some questions that are popping up.
Thank you very much. Let's next go to Washington Township Health Services perspective. Mrs. Cooper or Ms. Davis, do you want to share your thoughts about COVID in the last few months with parents?
Absolutely. Thank you so much, Dr. Woodson. I want to thank all of you for joining us this evening. Priority in Washington Township schools has always been excellence in education in a safe and healthy environment. The last quarter of school COVID-19 closure brought to light what worked and what we need to improve upon to begin this reopening process of the school year. So I assure you we'll all have that in the forefront of our minds as we talk about the plans in our task force in each building. That way we can continue that tradition of excellence in education in a safe and healthy environment in Washington Township schools.
Absolutely. Let's go to our hospital setting. Dr. Profeta, from an ER doctor perspective, what would you like to share with our parents about the past few months in this pandemic as we get started?
Well, when this first started, it's probably the most stressful period I think any of our emergency physicians have ever experienced. The volume in terms of critically ill people was off the charts. The overall volume of patients was actually down. But, at the beginning, realized that we literally thought that we were going to have physicians in our group and nurses in our group dying of this, respiratory therapists, that we were going to lose a substantial number of staff members. So the overall anxiety level in just caring for these COVID patients and not really even having a good understanding of its pathophysiology. I mean, this disease acts like nothing we have ever seen. It almost really doesn't even act when in the clinical setting like a typical infection. You have to treat them completely differently. I mean, we're putting people on life support right and left that and it was just a horrible experience. It sort of harkens back to my medical school days when I was practicing in the middle of the AIDS epidemic. But Washington Township as a whole, just, and I live in Washington Township. I live in Pickwick Commons, and the support of the neighborhoods and the people in this community in terms of shoring up the healthcare and helping our morale was second to none. I mean, I could not be more proud. But one of the things I think I have learned from this, and I feel more comfortable as we go on, is that we just are not seeing that many kids getting sick from this. And that is a good thing. Obviously, we need to sort of have a paradigm shift and focus on the at-risk population, realize that they can transmit these illnesses to their parents and their grandparents, and then we just have to sort of focus our attention there. But from an overall safety standpoint, in terms of sending your kids back to school, I'm actually fairly comfortable. Our pediatric ER wasn't filled with sick kids. Our ERs weren't filled with sick kids. They've done well. I mean, the national data shows that students in this age group, for the most part, do real well. In fact, we probably see a lot more critically ill children from influenza. But boy, the devastating impact it has on people at risk. I mean, we have got to do everything we can. We have to get our students to buy into this program of preventative medicine in terms of community health.
Thank you very much. Now we're going to go into some individual questions. The first question a parent asked was, what can parents do to protect themselves and their children? And I believe Dr. Kane answered that in her introduction tonight, where she talked about wash your hands, social distancing, and stay home if you're sick. So I am going to go to the next question. I'm going to give this question to Ms. Cooper or Ms. Davis. How do you suggest teaching young children about COVID?
So young children need calm reassurance that measures are being taken to keep them safe. We will talk to them about age-appropriate facts. We'll listen to their fears. We'll teach and model preventive measures. We'll post age-appropriate signs of proper hand hygiene and social distancing as a reminder of what they need to do to help keep themselves safe and what we're all trying to do to create a safer environment for them.
Excellent, thank you. Dr. McCormick, the next one is for you. Obviously, our parents are very in tune with information from the Department of Education, especially when it comes to reopening of schools. So the guidance that was issued June 5th is about 38 pages of guidance for schools. The parent is asking the question, why was this a guidance approach? And how were the guidance areas developed? Who helped develop those with the Department of Education? And why was the guidance approach chosen versus directives and requirements to all schools in Indiana?
I appreciate the question, and that's a great question, and we've been asked that a lot. We took that approach basically in collaboration with the State Health Department, with other state agencies, including the governor's office. We had medical people helping out. So this is a medical issue, and we were the educators that were trying to get to yes in a reopening of school, but a lot of it depended on the advice of the medical experts. So we looked at across the state, and the impact obviously in Marion County is very different from where I'm sitting tonight in Fountain County. It's just very different. And so we had to take into consideration communities, what was happening actually with COVID. The local health departments were sometimes giving very, very different opinions. There were a lot of different players in it. And for us to hopefully get as many schools open that chose to be open, the goal was some flexibility. And so you also have a lot of local school boards that have differing opinions about what's happening with COVID and the pandemic, and superintendents were also obviously answering to school boards. So we tried to leave as much flexibility that we could for local schools to get to yes in a reopening, but do it in a safe manner. We have been very clear on, you have to go back, schools have to go back to their local health departments, get that guidance regarding their plan. But we did that, and when you write a statewide plan, it's hard to do. But we also, again, our goal was to try to get as many kids back to a traditional setting as we possibly could in a safe manner.
Thank you very much, Dr. McCormick. The next question is about the hospital setting. Dr. Profeta, this parent would like to know, what is the hospital setting like now? We heard vividly when visitors were restricted at a certain point and loved ones had to, battle the illness on their own if they were in there for COVID. What is the hospital setting like now?
Well, I mean, it certainly has improved. I mean, we're allowing limited visitation. There still is that COVID infection risk, and we're taking that seriously. But you know, from a healthcare professional standpoint, we're treating every person that walks in that door like they have COVID. In fact, I'm treating every person I see out in the community like they have COVID-19. And that's what we have to have everybody doing. Everybody, just assume everybody's positive, and move on. But you know, we've loosened up restrictions a little bit. We've allowed limited visitation. We're still trying to obviously keep young people out of the emergency department. But, you know, in the beginning stages of that, I mean, we were taking people off life support off of FaceTime. I mean, think about how horrible that is. And we just can't get back there. We got to do everything in our power to keep that from happening again. So it's better. We're still seeing cases. There was, substantial decline over the last month, especially, but we're still seeing cases, and we're still seeing some very sick people too. And whatever we can do again to mitigate those instances and those cases, all the better.
Thank you. And I think that advice is really good. It would change your behavior if you just interfaced with the community as if everyone was positive. That absolutely would change your behavior and precautions you would take. So I think that's great advice. The next set of questions is for the health department. So Dr. Kane or Ms. McMasters. Dr. Kane, you began by giving some data on 400 cases a day down to 100 cases a day. But this parent asked, what is an update on COVID cases in Marion County? If there's other data you would like to share. Additionally, are children getting sick? We heard Dr. Profeta say at St. Vincent they have not seen a large number of sick children, but in Marion County, is that different? And last, this parent in the same light would like to ask, what are the indicators the health department uses to determine if things are improving or if we are entering another surge?
I'll let Melissa McMaster just talk about the update on the COVID cases in Marion County, and then and how many children are getting sick. And I'll follow by talking about what factors we look at to determine if we're improving.
Great.
Sure. So currently we have over 10,000 confirmed cases in Marion County. That's how many we've had, with over 650 deaths. The majority of the deaths, of course, have been in adults and those over age 65 and those with other chronic medical conditions. And primarily the top three seem to be heart disease, diabetes, or chronic lung disease. And then the question about are children getting sick with COVID? That's a tricky question. They're not getting sick with COVID, but they're getting COVID. So what's happening, we've seen very few numbers, according to the data that we have collected, of positives in children. In fact, currently, throughout the outbreak, there have been less than 300 confirmed cases of COVID in those less than 18 years of age. But one thing that parents should know is that the virus is sort of sneaky, because children are often infected, but they show little to no symptoms at all. And so they become the spreaders. So the actual number of children who have been infected is most likely probably higher. In addition, an individual who's extremely sick with COVID, who's an older adult, may have the exact same amount of virus as a child who shows no symptoms at all. So again, they're not getting sick, but they may be kind of being spreaders. Thank you.
So then I'll follow up by saying, what are the things that we look at in terms of if we can tell if we're improving? So the number one thing we were looking at was first of all, the number of cases, but primarily the number of hospitalizations related to COVID-19 symptoms. And then you'd also look at the number of emergency runs by the ambulances to hospitals that were strictly just for COVID-19 symptoms. And then at the beginning of the epidemic, of the people we were testing, what percentage of them were positive? So, late in March, we were having almost over 40% were positive of the ones who were testing. And so we look at the positivity rate of the infection of the people that we're testing. And we have now dropped, as of a week ago, we've dropped down to 13.7% are positive compared to when we were in the high 40% of folks who were positive. And so, and that's with expanded testing. And we've actually also, the actual cases have dropped in the last 14 days. So you see that we've definitely improved from our very first peak of cases, which occurred like in the first week of April. Last week of April and the first week of May was when we saw a surge of COVID-19 cases. Now, I do have to give this caution. You know, we saw the city have a significant number of protesters come into our community. A number of folks were from out of state, so you don't know what their infectivity rate is. And when you're protesting, you know, a lot of times you're shouting, you may be singing, and so it's hard to get that social distancing of 6 feet. So we might have some additional cases as a result of the protest. But that's something we're monitoring very, very carefully. And we feel we'll have a better grasp of that probably in the next 7 to 10 days when we look at our data. But otherwise, we are looking very good.
Thank you very much. It was very informative. Next question is for Dr. McCormick with the Department of Education. This parent asks about e-learning and accountability. The question is, we know that e-learning or at-home learning simply can't replace the teaching and learning process that happens within a classroom. If not before, we definitely know that now. How will the Department of Education account for COVID learning loss with the upcoming testing, accountability to schools, and curricular requirements?
Yeah, again, another great question. So we know nothing replaces great instruction that is face-to-face in a classroom. It is hard to replace that type of great instruction with a great educator. But e-learning was a great option for many of our students who didn't have the option of face-to-face, which was many of us at the end, and all of us toward May. So as far as the loss, we are well aware that when you lose that much instruction or it's modified, that you will have slide. And so many of our districts, whether it's superintendents, assistant superintendents, curriculum directors, principals, they're gearing up to, with their local assessments, to identify at the beginning of the year where those gaps are and target that instruction. And that is easier said than done, but a lot of our districts have great plans for that. We've also worked with our General Assembly about trying not to mandate anything, but be cognizant of, let's not just continue to test the kids to death, because we hear from families that the amount of time spent on testing, but this is one of those times where we do feel it's going to be really important to get that good baseline information and then target that instruction. But a lot of that is left up to local districts, and I have faith that they will do a great job with that when that time comes.
Thank you very much, Dr. McCormick. The next question is for Washington Township Health Services, so Mrs. Cooper or Ms. Davis. What training is provided to school nurses in Washington Township schools?
Sorry for that. The nurses will be trained on techniques for reducing transmission, appropriate utilization of personal protective equipment and infection control best practices. And on July 20th, the Washington Township nurses will have annual nurse training. The plan will be reviewed, all of their questions will be answered, and any concerns will be addressed.
Great, thank you very much. Back to the health department, Dr. Kane or Ms. McMasters. With the reopening of businesses that have rolled out statewide with a different rollout plan in Marion County due to the number of our cases, how is the health department in Marion County monitoring that rollout in relation to COVID cases?
So one of the things that we do, that when we get the reports of the positive cases, we look at where, if that person is employed, what type of business they are in. And so if you have an accumulation of a large number of those cases, then you have to say, are my prevention measures working? Are these individuals following the guidelines? And do I have to do special monitoring of those type of businesses, re-educate in order to say, you're not following guidelines, I need you to follow those guidelines. And I would say that over 95% of the individuals are very receptive and they make the changes. Occasionally, if someone is not compliant, we can charge them a fine. And if that's not effective, then we look at their licensure for their ability to do their business. And we've never had no one not comply after having a little persuasive discussion in terms of following the preventative measures. So whether you're in the school business, whether you're in a hospital business, or you may not be employed currently, you're at home, we have to try to determine where the source of that infection occurred so we can do contact tracing to go back and educate people who may need to require self-quarantining as a result of an infected case.
Thank you, Dr. Kane. I've certainly done 100% wearing a mask when I am out and about in public or at frequenting businesses, but I will tell you, I struggle following those arrows on the ground at the grocery store. I'm not the best at that. But it's glad to hear that businesses are abiding by the guidelines that have been given. Dr. Profeta, this next question is for you. This parent wants to know, how can they help their child when they return back to school to prevent the spreading of COVID and possibly causing the school to shut down again? As we just heard through previous discussion, students may not be symptomatic, but they may be carriers of COVID infecting staff would be the concern. So what advice would you give to parents to help their own children as we re-enter school?
Well, obviously I'm going to echo what Dr. Kane said earlier about teaching these kids about, social distancing, hand washing, mask wearing. Those obviously are very key elements, but especially when it comes to I'm going to sort of talk a little bit about the high school kids. We've got to have a discussion with these kids about their global responsibility as a sort of a community steward to healthcare. I mean, we can be sort of progressive in our thought in 1,000 different areas, but if we can't even protect the people in our community, where are we as a society? So we have to have a sit down and talk to them about these issues. But the problem is that your school is sort of unique. I mean, you had a faculty member die of COVID-19, and it really hit home for a lot of those young people. But most of these young people are out in the community, and maybe they know somebody peripherally or somebody from a nursing home, but they're not seeing their friends typically die from this. So the illness is sort of this nebulous mass that exists somewhere else that is not in the forefront of their thought. And we have to have a sit down with them as a parent. You have to sit down with your kids. You have to have a discussion and say, my child, you can bring this home to me. I mean, you can result in my death or your father or your mother's death or your grandparents' death or aunt or uncle. And, and also we have to be cognizant of the fact that a lot of these kids, especially these sort of at-risk kids or lower income kids, are being raised by grandparents or great-grandparents or people that do have significant comorbidities. And we have to have an open and honest discussion with our kids about the risk that they can, have to their own family and the people that they love. And, that's, that in of itself, talking about their responsibility as a citizen in a global thing, and then also talking about just the hygiene, aspect of it. So that's the best advice I can give right now. It's a scary time.
It is, but it's good advice. I appreciate that. Back to the health department. This parent would like to know, when school reopens, how will confirmed COVID cases by staff or students be handled?
I'll go ahead and take that, Dr. Kane. You're on mute.
I think she tossed it to you, if I lip read correctly.
I was just saying, I would love to have Melissa answer that one. That's her bailiwick.
So ideally, we'll be working with the schools to report cases either through their school nurse or through a designated person. And then the health department will do follow-up, advise contacts, help direct what contacts need to do, how long they may need to be quarantined. And we will also help direct the schools on next steps, including parent notification and, what do we send letters to one class? Do we send letters to the whole school? We'll be available to help basically on a case-by-case basis at this point. That's the plan.
Thank you very much. Dr. McCormick, this one is for the Department of Education. So this parent has recognized how businesses have been on a slow reentry plan or reopening plan that has multiple phases. This parent is asking about that guidance document we referenced earlier. Did the conversations that created that guidance document consider a tiered or gradual opening approach for schools just like businesses?
We did. We looked at a lot of different plans from across the nation and also having a lot of different partners at the table, including educators, but again, majority of medical folks. But the conversation really lent itself toward, keeping kids safe, but also the daycare issue that we're facing where we know kids are being put into unsafe situations because they have no other options. We also looked at the child abuse situation across Indiana. Those numbers are down. However, so is the reporting of that, and we're very concerned about that as a state. So there were a lot of factors that went into that reopening piece as far as how to do it gradually. Now, I will say starting July 6th, we can start athletics to some degree with a lot of provisions. We can also start some co-curricular, which would be band and some of those fine art programs and some clubs. Many of our schools are teetering with how to pull off career tech ed and some summer school. But we are doing it gradual in the sense that it's limited through July, but that start of school is really up to the local school systems. Many, from what I'm hearing across the state, are planning on opening on time. Because a lot of factors that play into that as far as feeding our students that go beyond the academics, the social emotional well-being of our kids, the health and nutrition of our students. But I want to mention something that Dr. Profeta said as well. I mean, it's interesting, and I hear him and I completely agree, but boy, I'm across the state and there are areas that you will not see a mask anywhere. And then there are other areas where you see a lot of people in mask and really doing their due diligence. And that's something that we're up against as far as the entire state of Indiana and how we pull off this reentry and the willingness of families to do their part. And I know in Washington Township, you've got great families and will do great, be very willing. Hopefully you'll have great participants in whatever guidelines are set, but that's going to be a struggle for all of us across the state as far as there's family willingness to comply.
Agree. Next question is for Washington Township Health Services, so Mrs. Cooper, Ms. Davis. They're asking about how will school nurses have a voice in the planning process, and how are you as leaders of the school nurses ensuring that clinics will be properly supported once schools reopen?
So our coordinator of health services, Stacia Davis, along with the IU Health Business Solutions RN manager of our nurses that are actually in the school clinics, they're in constant contact with each other. The nurses have been asked to share any suggestions, comments, or concerns so that we can help to identify areas to make sure we include in the suggestion in the plans for reopening of schools. And we've asked for additional staff support in each of the buildings so that we can monitor those students that are being picked up or sent home for COVID-19 symptoms, so that we can have somebody that's there with those students while the school nurses can actually still help care for the well students or students with injuries, things like that.
Thank you very much. Dr. Profeta, the $1 million question from this parent. From information in your field, how close do you think we are to getting a COVID-19 vaccine?
Who knows? I mean, there is no good answer. And it's going to take time to even know if a vaccine is going to work. I mean, think about it. We have to have a different vaccine for influenza every year because the coat proteins sort of change their antigen surface. So you may have a vaccine, there's some talk about the spike protein creating antibodies, who knows? Time will tell. And also realize the kids aren't going to be the ones to get the vaccine first. It's going to be the healthcare workers, people in the nursing home. That's where the vaccine's going to go first. When you're talking about 300, 400 million, doses within, the United States. So, I mean, we've got a lot of therapies on the horizon that are looking promising. There's some new data coming out that maybe dexamethasone actually works, monoclonal antibody therapy, plasma-enriched plasma therapy, remdesivir, other antivirals. But I wouldn't even bother worrying about the vaccine for the time being. But with that caveat, I would say this. We have to refocus on influenza come the fall. And we have got to get these kids vaccinated for influenza so it doesn't muddle the entire picture of COVID-19. We have got to be more diligent in getting these kids vaccinated. That means we can do it in the Washington Township school system on the property, all the better. But the more that we can get vaccinated for influenza, the better.
That is an outstanding point. As we transition in the next question to the health department, I will add what are plans for vaccine availability for flu, looking at this upcoming fall from Marion County Health Department perspective, but also I'm going to throw in the next question from the parent. Everyone recognizes and celebrates Washington Township's diversity. This parent has seen disparate impact of COVID-19 mortality on people of color, however, specifically African American and Hispanic. What is Marion County Health Department doing to reduce barriers for access to health care and testing to keep everyone in our community healthy?
So looking at our data, we can tell that on children testing positive for COVID-19, there is a disproportionate amount of cases in the African Americans and also our Latinx children. In addition, we have, in terms of trying to address this, we have tried to set up testing sites in areas that are accessible to these vulnerable populations, have made the testing free, and our testing sites does not require a doctor's order. And so that we think has really been substantial related to this, but we have to continue to work with our federally qualified community health centers, our other community health centers that we have throughout the city. We're continuing to work with our Patient Safety Coalition. This is hospital systems. These are private providers to say, hey, I may have individuals who don't have the income to be seen. I need some pro bono services offered to these clients. And for our community health centers, they're a sliding scale based on your economic income. If you don't have any money, you don't have to pay anything. So we're really trying to track that very carefully, but I think the key is having access to free testing, but also how to access primary care when you may not have a provider.
Excellent. Anything on flu vaccine for the fall? Access and availability in Marion County?
I'm just going to add a few words. I'm going to Melissa jump in, but Dr. Profeta knocked it. He knocked it on the nail, and that is we have to have a huge campaign to get everybody vaccinated for influenza. And that's not only children, but our adults, our seniors, folks who are eligible, who are immunocompromised, and we have to get that early. So we can't wait till the flu season happens. And then we're having so many patients sick from COVID-19 as well as influenza. It'll just overwhelm our healthcare systems. We won't be able to handle both. So we were very fortunate that this COVID-19 season happened at the tail end of our influenza season, but we've got to be prepared. So that means we know we've got to increase our orders in terms of having influenza vaccine more available for our communities, and we really have to have our providers push this in the doctor's office, and we have to have a community campaign where that parent is telling that doctor, hey, when am I getting my influenza shot? But we're working with a lot of pharmacies to provide in their clinics, many clinics, to give vaccinations. So all type of incentives we need to put out there for everyone to receive their influenza vaccination.
Thank you, Mrs. McMasters, and then Dr. Perfetta.
Yeah, I just want to add, so the real concern that Dr. Kane is alluding to is the idea of influenza and COVID co-infection. We don't know what that would look like, but also what about COVID and measles? That would not be a good co-infection either. And we are behind on childhood immunization, so we're really ramping up this summer trying to offer clinics to get kids caught up. Also knowing that we can't do the mass clinics of old with people lined around our building, we have to have social distancing. So we are planning for clinics, not just for influenza, but all of our vaccines, really to get kids up to date in a timely fashion.
Thank you. Dr. Perfetta, you wanted to weigh in.
Realize that when we talk about some of these issues about the impact of COVID-19 on the minority communities, realize these are our patients. There are ER patients here in Indianapolis, and we see what the comorbidities are, and a lot of it is access to antihypertensives, to insulin, to asthma medications, to a whole lot of other preventative care kind of items. And especially now with people being employed or people not being able to get transportation to the drugstore, so many of the patients that we see now are coming in with uncontrolled hypertension, uncontrolled diabetes. They've been sitting around at home having heart attacks, now are in congestive heart failure, and still people are vaping and smoking. So there's a lot of preventative medicine issues that we can address. But boy, if they're out of their meds, especially hypertensives and diabetic medicines, just come to the emergency department. Let us work with case management. If these kids have parents that don't have access to that stuff, we have people that can help them at least get a temporary supply of medications, but utilize whatever resources. But it's so unfortunate because so many of the doctors' offices are either shut down or they can't access care that they may have been able to access in the past. But we're available. We're here 24/7, so we'll help you out if those issues come up.
That's outstanding. Thank you.
Dr. Perfetta, can I make a special point? Because a lot of people I don't think understand this, and you say, wow, why are sometimes these people not compliant with their medication? Well, if you don't have any insurance, you have to pay the full retail cost of that medication. So a high blood pressure medication, just the medication alone, could be over $200 a month if you have no insurance. But if we employ and our employer provides insurance to us, I may have a little copay that's $15 or $25 a month. I can afford that. But if I've got no insurance, I'm paying the full retail value. So then you're trying to trade up. Do I take this medicine, or do I have food on my table? Or, boy, I really would like some electricity here in my house so I can get some hot water, take a bath. So we've got to understand that if they don't have insurance or some mechanism of insurance, it is a huge barrier for a number of adults, especially if they're not making a living wage. A living wage is higher than that $7.25 minimum wage we've had for 30 years and has not budged, but our inflation of everything has increased this past decade.
We do have creative ways of getting people assigned to Medicaid and Medicare. There are, we actually have coupon programs. There's things that we can do. So don't give up though. Still come in if you need to. We will help you. We'll figure something out. If I have to, help pay for it myself, I will. I'll get some of my partners to kick in, but we'll get you that insulin. We'll get you that antihypertensive. We'll do what we need to do to make it happen for you. We're not going to abandon you just because you don't have money. Every emergency department in America is like that. You just have to ask for help and be creative, and we'll make it work.
Thank you.
Thank you all. Very, very good answers and helpful information to our parents. Next question is for our health services in Washington Township. Will there be an isolation area for staff or students who during the school day develop COVID symptoms?
Yes, building foreman and Stacia, our coordinator of health services, will work with the principals to identify an area in each building, because as we know right now, our buildings are very different. This area will be to accommodate students with COVID-19 symptoms, and they are awaiting pickup. This room will be separate from the traditional clinic that we have at the schools, where well children with chronic health conditions are being treated, or school injuries, things like that. It's imperative, though, that parents who are called to pick up their child showing COVID-19 symptoms to pick up their child immediately. One of the best ways we can prevent the spread of this virus is by having the child get to home and quarantine there as soon as possible. For staff, they're able to go home, so that's in the plan. We'll talk about what they need to do, whether it's alert their supervisor and then leave the building immediately, coming in contact with as few people as possible, wearing a mask, and exiting the building as soon as possible.
Thank you. Great information. Back to the health department. This parent would like to know, with reopening of schools, how will the health department support contact tracing with COVID cases of staff or students?
I don't know, hey, Melissa, you want to take that one, or you want?
Sure, I can take that. So currently, we do contact tracing in partnership with the State Department of Health. So we work with them to make sure that we follow up with cases and contacts. I believe in the future, the Marion County Health Department will be hiring its own contact tracers that are trained by the Indiana Fairbanks School of Public Health, and we'll be using those. And more information on that process will be available early next month. We're just kind of getting that whole program together. So basically what will happen is you'll contact one of us in the infectious disease department, and we'll assign a contact tracer and work from there.
So let me just make this clear. We've always been doing contact tracing. And we've had primarily our communicable disease nurses and our nurses helping to assist that with other personnel. But when you were starting to get over 400, 600 cases a day, that's huge to spend time with an individual to find out all the activities that they have experienced in the prior 14 days where they were within 6 feet of somebody and longer than 15 minutes. That's very time consuming. So we had to prioritize particular high groups in terms of who we should use for contact tracing. But our National Association of Local Health Departments have figured out that based on an estimate, for every 100,000 personnel population, you need at least 10 contact tracers. So we know in Marion County, we need a minimum of 300 contact tracers. And we got about 50 folks doing it in the health department. So the city of Indianapolis, from that CARE Act funding, is going to use some of that money, partnering with the health department and Fairbanks School of Public Health under Dean Paul Havison, to get the sufficient number of contact tracers we need in order to cover Marion County, to help subsidize the contact tracers being utilized by the Indiana State Department of Health. So hopefully we'll have the sufficient number to be prepared. Going on into the fall and the winter, we're going to have it. We've got it.
That sounds great and good planning and foresight, but that is a large number of people needed just for that one task.
Yes.
Next question is to Dr. McCormick with the Department of Education. This parent is referencing the universities in Indiana who have modified their calendars to send students home for the winter starting at Thanksgiving break due to the predicted increase in COVID cases over winter. Should K-12 schools consider this model of a calendar also?
Yeah, I do believe K-12 schools are considering it, but there are parameters that impact K-12 that impact higher education. So I've heard people say, let's let them out at Thanksgiving and don't bring them back until January. If you are a kindergarten working parent, that can be very, very difficult. So that daycare issue, also that loss, that 4-week academic loss, and we just don't know what's going to happen. So what if, after Thanksgiving through December, there isn't a spike? And so there are a lot of things to consider. What I will say is Indiana, our lawmakers have made it clear that there's 180 days of instruction, and that is going to be the requirement and the expectation. So how our districts get those 180 days in, whether it's virtual, whether it's brick and mortar, or whether it's a hybrid of both, will be completely up to districts. But the university model, I think, is a smart thing for many of our universities. We just have other issues that we have to consider, knowing that we're servicing kids in many of our districts from age 3 on up to age 20. So it's a little different.
And because this question is talking about this resurgence or this second wave in the fall that's been in some of the predicted COVID models, I'm going to go to the next question to Dr. Perfetta. There are news outlets predicting the second wave of COVID. As a health expert, what are your predictions?
Probably. I mean, it makes sense, but I'll tell you, I think that we'll probably have less deaths from it the second time around. We know more than what we're doing. We have more drugs. We have more therapies in our armamentarium. We know how to manage these people on ventilators better. We know how to manage their fluid and ventilatory requirements. I think we're better prepared for it. I think that our nursing homes are better prepared. So yeah, we may have more people positive, but I think our fatality ratio will drop substantially from what it was in March and April. So I'm hopeful from that standpoint. I feel a lot more comfortable taking care of these patients now when they come in the emergency department. People that I know that a few months ago probably would have died from their illness, we're keeping them alive. So we're doing a better job. So
promising to hear. Very promising to hear. Back to the health department. How can a Washington Township parent get tested or get their family tested for COVID currently, right now? And I'm going to do a two-parter on you. Can face shields be worn, the plastic pieces that kind of have a headband, or what the face shields they're referring to, can they be worn without masks to protect against COVID?
I'll let Melissa answer the question first about the testing sites, and I'll answer the question about the face shields.
So there are testing sites throughout Marion County, several of which the Marion County Health Department is actually holding those testing sites, and there are testing sites throughout the state. So the best way to find those sites is on our website, marionhealth.org, and the ISDH website. But what I'm going to do is put together a document with those links and send that to you so you can send it out to parents proactively, because they're just, every day there's more places popping up that are doing testing. So it's becoming much more accessible.
Great. And I will pass that along. Thank you.
Now let's talk about those face shields. So we know that there's just been some recent recommendations, I believe, from the Department of Education, who's talked about that face shields might be used in place of face masks in certain settings, especially for young children. Up to, I believe, kindergarten to 4th grade. But let me talk about face masks, for example. Depending on your building situation and your ventilation, those masks can be real hot if you got to wear them for 6 to 8 hours. So that's the first thing. Sometimes they can irritate the skin. They can fog your glasses. They may sometimes make it difficult for someone to breathe, especially if you're an asthmatic or you have some other lung conditions. And what about those students or even adults who it can be difficult for people who have a hearing loss, because it's hard for them to communicate when their mouths are covered, and they need to see that mouth sometimes in order for them to understand how you're communicating. But here's one of the other most important things. How do you have life in your school systems and working on a daily basis, and I can't see your smile? Superintendent Woodson, I love to see that smile on you. But, how do we give encouragement to our children? We're talking to them, they're asking a question. They can't tell if you're serious, you're joking, because they can't see your facial expressions. So there have been some recent studies now. I know some out at UCLA. They've done some simulated studies to show that face shields may be as effective, because what happens when you got a face mask for 8 hours? You are constantly pulling that mask down so you can breathe, okay? And so how many times are we touching our face, touching our mouths, trying to pull that face mask down? Whereas if you had a face shield, you don't have to constantly touch your face shield, and you can free to communicate, and I can actually see your face through those coverings. But I do have to highlight that those individuals who are older than the age of 60 and they have chronic medical conditions, or they may be immunocompromised, as teachers or even students, they may be required to wear the face covering. But we don't have our final recommendations related to this, but I suspect we're going to be very flexible and have a higher utilization of face shields than we had planned for related to face coverings.
I would just like to add, today, the Infectious Disease Society of America actually came out and said for younger students, face shields may be the answer, including educators of younger students, so they can still see the face. So this is an emerging issue that we'll be learning more about, but it will play a role, I think, in opening.
And also another reason for parents to understand why we can't rush to put out a plan today. We need more time and for more developments to unfold, like you just heard are recent. So we appreciate it.
I mean, this is hot out the press today. Okay, so this is a fast, rapidly evolving disease, and that we're learning every day, but we want it to be practical, effective, but at the same time doing this job of prevention of transmission of this disease.
Thank you. Dr. Perfetta, this next question is for you. Temperature checks and screenings would be impossible for schools to implement, and based on data, they do not protect from COVID. Approximately 35% of those infected will be asymptomatic, and even those who develop symptoms usually have 3 days before those symptoms manifest themselves, during which they are contagious. Knowing this information about asymptomatic carriers of COVID and the impossibility of us doing temperature checks and screenings with thousands of kids every single day, what is the best protection in the community as we interface with businesses or stores and in schools that parents and staff can take?
Well, it sort of goes back to what I said earlier. Assume everybody's got COVID-19. I mean, you just have, it is incredible how many people that we'll have come in for something like they tripped on a stair, break an ankle, and we do a COVID screen for them before they have an operation. They turn out to be COVID positive. So assume everybody's got COVID-19. So what that means is sort of shift the focus on people that are at risk, especially for your faculty members and your staff. And this is this even is sort of where we are in the healthcare community. We have doctors and nurses that have to sort of look at themselves and say, do I have a lot of comorbidities that puts me at risk of getting an infection, possibly dying from it? And if you do, you probably are going to have to stay off work. And it's the reality of the situation until we have a better understanding, or we have a vaccine, or we have better therapies. But there probably are people that shouldn't be working. And that's as blunt as you can be about that. But those people have to decide that on an individual basis. You know, I don't I certainly don't have any issue with people screening for temperature checks. It's one more level of maybe trying to identify some of these sick people. But yeah, I think it probably is impractical. So if in an ideal world, as a parent that had Washington Township kids and who my friends are there, in my ideal world, I'd have fans in every window of every schoolroom blowing air out, recirculating the air. I'd probably try to have as many classes as I could outside or in open air environments. You just have to be creative, and whatever parents can do to help support you in that endeavor, so be it. But that's sort of what we need to do. We have to be creative in our approach to taking care of this. We have to realize that as Dr. Kane said earlier, this is a fluid illness in terms of we're learning stuff literally every day about this disease, and it just does things that you don't anticipate. And knowledge is good, and we're going to make it through this, but we are going to have to be creative in our educational process and our thinking about protecting the schools.
Thank you. We discussed tonight staff members or adults with chronic health conditions. This next question from a parent is to our Washington Township Health Services regarding children or students with chronic health conditions and guidance to parents for reopening of schools.
Simple precautions should be followed to best protect children with chronic health conditions. Social distancing, 6 feet, wearing a mask, hand washing 20 seconds with soap and water, reminding children not to touch their face, taking precautions in your home is critical as well. Cleaning frequently, touch surfaces, washing dishes and clothing quickly. Keep anyone who has an illness in a separate room of your home. Check temperature and well-being of your child every day before they leave for school. These precautions at home and at school will help your child stay as healthy as possible.
Thank you. Great tips. Next is for Department of Education. Masks were recommended in the guidance that was made public June 5th. This parent is asking about the likelihood that their child might take off that mask during school. Understanding the complexities of schools, we can't police mask wearing of 11,000 students every day. What advice do you give to parents if they want their students to wear masks all day, but they know they can't be there to enforce that, and they know it's not realistic for schools to enforce that?
Yeah, I think Dr. Kane brought up too that some more information is coming out on shields. I know Dr. Box, who's the commissioner for the state health department, addressed that in our webinar this week, that more people are starting to ask us about shields versus the mask. I will be honest with you, those are expensive. So you get into the situation as far as what's affordable and what makes sense for our schools. So enforcing masks or shields will be very difficult. I know when we were trying to come up with recommendations, a part of it was that the medical folks were very adamant about if social distancing cannot happen, there has to be precautions with a face mask. At the time, we weren't talking shields, but a face mask. For instance, we cannot afford to run a bus that has 72 passengers with 15 kids. We can't afford to do it. So if that were the mandate, it would simply be we're not going back to school. So we were trying again to be realistic and practical about what can we do. That's where the masks come into play. What I don't want to do is create a discipline nightmare for schools to police it. We will do our best to educate kids and the role that they play of this and families and encouraging students to be active participants in this. But it is going to be really difficult. We're also very aware, and Dr. Box shared this, wearing those masks or face shields on a bus versus when you're just sitting in class, maybe watching the teacher and you're all in the same row facing the same direction. There are times where you can take those down. When you're eating lunch, when you are in an active, rigorous participation with PE, maybe outside. And there are different times about being smart and educating a child. I'm also very aware from the emails I've received, look around. It's going to be hard to have 3, 4, 5 months of students not wearing masks for us to go into an environment where we are mandating any type of facial shield or mask. So yes, challenges, absolutely. But I think it goes back to working with families, educating our students, educating our families. Everybody's got a responsibility in this. But I think schools don't want to get into is a big discipline battle. And that's all we would get done. So challenges, 100% that's going to happen, but I have faith in our schools that we will do due diligence in making sure we come to some type of an operation with that.
I agree with you. We are down to our last couple of questions as we wrap up our time. This one is for the health department. This parent is asking about multi-generational households. What specific guidance or resources does the health department have to mitigate COVID-19 for vulnerable populations who live together in the same household?
Melissa.
So you're right, of course, that group is experiencing the worst outcomes with this virus, as we mentioned. So again, it's simple things that we've mentioned before, frequent hand washing, cleaning those high-touch surfaces. But I think key is if someone in the household is sick, they need to be isolated in a room and stay in that room and not interact with the older adults. I know that can be difficult, but that's what we really recommend so that that older adult does not actually catch the virus from the child.
Thank you very much. I'm going to share some pieces of information, but I'm going to ask our panelists to think of some closing remarks as I do this that you may want to share with Washington Township parents. There are a series of questions that were asked by parents that we simply don't have the answers to yet, but know that we are developing a plan in collaboration with the health department and the Washington Township Reopening Schools Task Force. A plan will be released in July for parents and staff to be able to review. So I want to acknowledge these areas of questions that parents asked. I did not pose them to the panel because I know we simply don't have the finite answers to them yet. These areas are cleaning procedures for Washington Township schools and buses, how many additional staff we will be hiring to implement the opening of schools plan, air and water quality measures in Washington Township schools that we will be taking, changes to Washington Township policies or procedures that may be needed due to the reopening of schools plan, any modifications to the instructional day that may need to be made. It is our intent to have a regular school day as it is posted, but the instructional day or what time classes start and end may need to be modified within that school day. So we don't have details on that yet. Teaching and learning opportunities beyond attending school in person for those who are uncomfortable. We are still developing those plans. Social distancing criteria details for each school level. We are still unpacking that. It's a very challenging area, and updates for staff procedures. So all of those, I wanted to recognize those questions or areas of questions that were sent in by parents. We simply don't have the answers to that yet, but are working diligently every single day to work towards the reopening of schools plan. So we've got 10 minutes left, which I think is perfect for the closure. Before we go to the closing remarks, I just want to say thank you. Each of you are leaders in your areas and have very, very busy schedules. It is a delight and an honor to have you speak to Washington Township and our community tonight on this very, very important topic of COVID. So we appreciate each of you. And when the time is right, I'll take you to lunch. So in conclusion, what final guidance would you give Washington Township families as we close out from your leadership perspective? Let's start with Dr. McCormick from the Department of Education.
Well, again, Dr. Woodson, thank you for the invite. Washington Township parents, thank you for your time and your support. Again, this is a very uncertain time. This is a very fluid situation. What I will say is Washington Township is going to do the best they can to address the safety, the health, and the well-being of your students and your educators. I have no doubt that that is the charge. What I will ask of parents is you may not love everything that comes out in a plan, but we are asking you to please realize that a lot of difficult decisions are going to be made in a very complex environment, and we appreciate your support. I would encourage you to communicate with your schools, but meet us halfway. It's going to be very important that we're all in this together for success. So thanks again, Dr. Woodson.
Thank you. Let's go next to the Health Department, Dr. Kane and Ms. McMasters.
Right, so I think what you see here is such a critical partnership. When you look at the Department of Education, you look at our own township school, You look at the fantastic healthcare system with Dr. Profeta and what they're doing from a hospital system. And you have your local health department partnering here. And it's your transparency that you provide to the parents. You know, we're giving them the very best answer that we have, but it's that collaboration where you're bringing all of these bright minds together, and what we don't know, we do our research to try to find those answers. So I think it takes a lot of planning, it takes hard work, and you've got the framework because you've got an incredible staff at the Washington Township School. So you're already starting out, you know, batting 100. So, and I'm just grateful that we have this opportunity to answer a number of these questions, and you brought the experts in here too for us to, and I learned a lot too from this process, and I just, I can't compliment enough. Let me just say, the incredible job that you have done as superintendent of Washington Township Schools. And my God, when I met Dr. McCormick, I'm saying, wow, who is this lady here, boy? I mean, she was so impressive. She was spouting out that information. And I said, my God, here we have a dynamite Department of Education that's so incredible to recognize that one size does not fit all. And I think that's the key. And so it's just been an honor and pleasure. And parents, do the right thing, listen, call us if you continue to have questions, because we are your resource for you. And we're only too happy to help to provide those services, because we got a future generation of leaders here. So we got to protect them, make them safe, okay? Because they may be responsible for paying my paycheck, you know, as they get older, okay, and making some huge, good health policy decisions. So just so grateful to be in this environment at a time like this when we're challenged, working so closely together with everything. And I do, she's not on here, but I do have to give kudos to my colleague, Dr. Christina Box, who's the commissioner for the Indiana State Department of Health. I've enjoyed immensely working with her. And when I tell you, she calls me at 12:30 in the morning now. She messes up my time that I watch Perry Mason from 11:30 to 12:30 in the morning, but I'm not going to hold it against her, okay? All right?
You need your
Melissa?
self-care time, Dr. Kane. You
Yes,
need self-care
exactly.
time.
Right. So, Melissa, I don't know if you want to say anything or add anything.
I would
You-
just be brief if you can hear me. You know, we had lots of questions about the second wave or what's it's going to be like in the fall. All of these plans that we're putting in place is to prevent that. And so I know it's going to be inconvenient, but the whole goal is we don't want to go through that outbreak again, just like Dr. Profeta mentioned. So it's how good we do this to see what will happen in the fall. Thank you.
Thank you. Washington Township Health Services, Mrs. Cooper and Ms. Davis.
Yes, well, going back to school is definitely going to look different than we've ever seen before, parents and children alike. I will say one thing that will not change is the requirement of the state required immunizations for attending schools. So please, parents, be sure to get your students updated with their state required immunizations. You can call your healthcare provider to find that out if they are up to date or not. You will continue to get a few emails reminding the incoming seniors and incoming sixth graders from me. That goes out to all parents, not just parents of students who are out of compliance with immunizations. Just reminding you not only about the state required immunizations, but also about the recommended influenza Min B for the seniors and the HPV. So please read that information. If you have any questions, don't hesitate to email me back. But because of this current situation being so fluid, we will all need to be flexible and ready to adapt at a moment's notice to ensure the safety of every child and every staff member in Washington Township. And that is definitely what we want for everyone, a safe environment. Thank you.
Ms. Davis, anything? Okay. And finishing us out, Dr. Perfetta, last words for our Washington Township parent community.
I just want to sort of reiterate sort of the fact that it's not your kids that we're going to be seeing in the emergency department from COVID-19 should this start to ramp up. It's going to be their parents, or their grandparents, or their great-grandparents. We have to emphasize that over and over. Whatever, if you have some issues involving medications or preventative care issues, we're here 24/7. We have 24-hour social workers. We have 24-hour case management. We're right down the street from North Central High School, real close to all the schools. We'll make it happen to help you out. When you're bringing the kids, one of the things that, again, sort of thinking outside of the box, think about your neighbors and your friends that may have care providers or have guardians for these kids that are at significant health risk. If you're capable of maybe housing those kids at your home, if your house is healthier, if you're willing to do that, think about that, or helping people, go to the store or run errands for them that would prevent their exposure on a social level. Please continue to do that. Please continue to take it seriously and help your friends and neighbors in this regards. Everything that we can do, every little bit of behaviors that we can alter to decrease transmission and decrease this from showing up in our nursing homes, and our parents and our grandparents would be welcome. One of the things I would consider doing is making sure these kids shower or bathe the minute they get home from school. I mean, it's what every one of us do when we're coming home from the hospital. But just again, constantly emphasizing the hygiene, the mask, the social distancing, and being good citizens of this community, and continue to make Washington Township and North Central High School and Panther Nation proud, and we'll get through this.
Absolutely. I agree with you. We will get through this because we are Washington Township, and that's just how we do things. But we could not do this work without your leadership, without your expertise in these areas. So on behalf of the entire Washington Township community, thank you, and thank you.